All right, welcome everyone to our August Office Hours Collaborative. So my name is Cristina Hernandez, she, her, ella pronouns. I'm one of the special projects coordinators on the Office of Community Health and Engagement team. And so this month we have James Barta and Sean will be doing the majority of the presentation, but James is going to be sharing some updates around assistance with SNAP for partners, and then Sean will take it away with all of our OHP updates and bridge updates. So James, the floor is yours, or the mic is yours.
Great. Well, thank you, and thank you for letting me be at this great forum. And before I get rolling, I want to acknowledge one thing that is, if you're a medical partner, is that the last week and a half, this one system has been slow. Okay. Okay, let me introduce myself so I can put some more context in this. I'm James Barta, he, him. I am the engagement strategies coordinator with the Oregon Eligibility Partnership. We're the ones who manage the one system and eligibility. And there's been a lot of internal turmoil about the slowness of the one system. We know about it. The analogy is that, it's like a funnel. And typically, whatever information we pour in goes through the funnel and it's okay. But for whatever reason, right now, it's gotten constricted and has slowed down. And so sometimes some of this information we're pouring in flows out the outside, which means the analogy is it's getting timed out. So it's not working. So I just literally saw a message about 10 minutes ago that there has been some improvement this afternoon. Just to let you know that we're working with Microsoft. Leadership is working with them to make some big critical changes aimed at reducing the issues caused by these servers hitting capacity. And the Office of Information Services is working with Deloitte to look at the coding issues. So just all hands on deck to make sure that we are getting over this problem as soon as we can. So uh, just wanted to start with that since I'm with OEP and I figured I'd take that opportunity. All right. So the next slide, I'm here to talk about the SNAP assistance. And as you probably know, not necessarily, that medical assisters, like yourselves, can now call the community partner focus team to assist with SNAP benefits. Now, this is only a small step. It's not a change in your access. You're not going to be able to look at SNAP information. But what you can do is help your clients apply for SNAP and SNAP renewals like any other community partner can. And you can and you have the advantage of contacting the CP focus team. So the eligibility worker you reach can conduct a SNAP interview. You can also help a client create one account. So um, and and there's mechanisms then that you can also report changes and provide verification documents. So let's go on. And I just, before I get rolling on stuff, I just want to reiterate the limitations. This is a small step. And so I'm literally repeating what I just started the last slide with. But I also want to point out that the applications are not like what it is for medical. You're still going to need a physical signature or DocuSign signatures for these applications, unless you're doing it through the one system. And 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 you need to have the applicant with you if you're going to be on the phone with an eligibility worker, or you can have a signed 3010 form. And I'm going to talk about that toward the end of my presentation. All right, next. So basically you got these three options. If you have time to complete a full SNAP application, as probably know, that takes a bit of time. But if you have that time, uh, you can first you can assist them to create a one account where they can submit a SNAP application, or they can call you can call the community partner focus work team, eligibility team, and have them do the interview, or you can help the client fill out a paper application. So the next three slides, I'm going to go through these three options. So on the next slide, we've got creating a one account. And I'm going to, those links you see toward the bottom, I have them all on one page at the end of my part of this presentation. But uh, working for ODHS and Oregon Eligibility Partnership, I like to make plugs that encourage people to open one accounts. Now, of course, that's not for everyone. Some of your clients just aren't going to be comfortable even on the mobile app, but there are advantages. So anytime I speak to these groups, you've probably have heard me make a pitch that having a one account allows clients to track their benefits, to see when their appointments are. It's, they get so much paper from us, I know, and it's annoying, but there's now just one place where all their correspondence is. They can more easily upload documents. Often when they're applying for other programs, whether it's housing or early childhood programs or whatever, they need proof of enrollment. One account will offer that to them easily. So we have various resources in these links to help people apply. And if and if none of these are very long, they're relatively straightforward. So I'll encourage you to thank you for putting all those links in there. But there'll be toward the end, I'll have a Spanish link as well. But so just want to encourage that for those clients who can handle using either a laptop or their smartphone. Now, that last line of the slide, just want to notice that a person will still need to do an interview to complete their SNAP application. This is a federal rule, so that's just one of the differences between SNAP and medical. All right, next slide. So you can simply call. If you have the client with you and they can talk with any eligibility worker, but also with the CP focus team. And this, of course, is just for the community health and engagement partners, but you can join the call with the client. So any questions? I'm sort of rolling through stuff here. Feel free to raise your hand or whatever. I don't think it's just the primary on the case to report. I'm looking at the comment here. Can report a change or upload documents. So that's something you may have to follow up with. But in the next slide, this third option is, of course, if you want to go full retro, okay. But fill out the paper application. It's only 20 pages long, although a lot of that is text. But and a lot of this is a general application, I should say, in all fairness, too. It'll include questions solely for TANF and ERTC. But if you follow the instructions, you can do the paper application, and then there's a ask them to go to their local ODHS office and turn it in. And once again, they'll still need an interview, though. So we go to the next slide. So some things you probably know already, SNAP benefits, once upon a time called food stamps, but that hasn't officially been called that for 20 some years, but I still see newspaper articles generally call it that. But people can buy all sorts of food, but they can't buy beer and wine, smokes, supplements. They can't buy kittens off the street with it, and they can't buy non-food items, often necessary items, but nonetheless, um, you know, sort of common sense limitations. They can use these at their EBT card, their electronic benefits card at farmers markets where they can get a match up to $20. And their benefits come at the beginning of each month. They're spread out over several days. So different people will get their benefits over that first week. All right. And some eligibility basics too. Um, and back to that, the comment, Peter, you made. Yeah, I can understand where that's a rumor because some states are implementing that. Oregon has not implemented a limitation around soda yet. So, but as for eligibility, I'm going to start and end with that bottom line there. When in doubt, please always encourage clients to apply. But in general, the income limit is 200% of the poverty level. I pulled the latest data and put it in the right side there. But that's just a guide because people's incomes can be, it's a net income. You can consider the cost of child support, medical expenses, housing, shelter expenses like utilities. Those can be subtracted from the income. So really, this is just a general guide. If someone has an income a little above that, they still are likely eligible for SNAP. So again, encourage them to apply. And then, and one thing to know about SNAP too is that it's based on your income level. So if you have very low income, you're going to get the maximum amount, but as your income increases, the SNAP grant does drop off. And even if someone has a zero grant amount, which happens to a handful of people, you still get access to job training programs, and it still could make you eligible for some other programs as well. So please encourage clients to apply for SNAP. All right. This next slide is sort of incomplete because things are in such flux, and I didn't want to get into too much detail. So you might ask me plenty of questions about this. I have plenty of questions, and I just didn't want to get over my skis and talk too much. So I put a couple things here, like the whole state now, not even through the recent federal legislation, this is from older legislation, but the whole state is now going to be required starting in, what is it, September, that people who do not have dependents, able-bodied adults without dependents, are going to be required to work. And if they're not working, they're only eligible for SNAP for 3 months over a 3-year period. And the age limit has changed. There's some ambiguity whether it's 64, 63, but it's for people without children younger than 8. So, and I know there's other eligibility changes coming. And so that would be a future discussion, though, to talk about those phased-in changes. Like I do know that after a lot of work last year, COFA, people with COFA status, meaning they're citizens of Micronesia, Palau, and
Marshall Islands.
Marshall Islands. Yeah.
COFA is the Compact of Free Association.
Yes, thank you, Sean. And they will keep their eligibility, but some of the groups are losing it. I just don't have the timelines in front. So, but we can talk about that more another time. So I want to acknowledge, though, this is difficult and trying times for a lot of people. So going on, you'll notice at the beginning when I said, if someone has a lot of time, do the SNAP application. If someone doesn't have a lot of time, then you can still do something really critical and help them set a filing date for the SNAP. So all you need to do is you can submit the first regular page of the paper application, that 415F. And the trick is, when a filing date is set, then whenever their application is completed, the benefits are retroactive to that filing date. And technically, a filing date can be set by anyone who walks into an ODHS office and gives a piece of paper that has their name, address, and their signature and saying they want to apply for SNAP. So if someone doesn't have the time to do it, then please have them at least submit something like that. And they'll still have to have an interview. Like this note says, if someone only put their mailing address, then they'll get a piece of mail requesting an interview. If they put their phone number, then the eligibility worker will try to call as well. So that is something that everyone should at least do. So on the next slide, we'll talk about that release of information form. As always, you need to collect the 6610 for the medical consent to assist at all. But the 3010 is a little different. You can do all these things that we've been talking about without the 3010 form. You can be on the call. You can help them create a one account and submit an application to the one system or submit a paper application. But what this is for is if you want information when the client's not there, then you're going to need this 3010 form. And as my last bullet there says, despite what the form says, for whatever reason, mysterious reasons to me as well, the release of information is only good for 60 days. So it's not for an ongoing relationship. This is more for troubleshooting an application and just getting those benefits off the ground. So think of it that way. And on the next slide, this 3010 form, I readily acknowledge it's confusing, but it's something that the SNAP and TANF policy teams and child care teams use. As you can see, the very top part is the applicant's information. And then, who are you releasing from? This is ODHS and typically self-sufficiency programs. And you have the information that are below who the contact person is in the phone and email. And the release is to your organization. Now, there's also these boxes, the purpose of disclosure, sharing, and use. Don't overthink it. It's just something like SNAP application assistance. And it's in the release form and in the release to section. And then finally on that page 3, you're still going to need that physical or DocuSign signature. So, and then if you want to be slick about it, pre-fill a few so you can save yourself some time and the client is actually there. All right. Then my final slide for this, I got to give Sean some time to talk about other things, is the resources. And Christina kindly put some links earlier, but I think this captures all the links. You got your 3010 form. I didn't talk about this eligibility 101 or outreach toolkit that the SNAP policy team has put together, but it's really helpful to give a nice overview. Now, there you go. So technically, this is for organizations that have a SNAP contract, which is about 20 in the entire state. And I think they will need to update this a little bit, but it has a lot of useful information. I'll make a plug too for that third bullet. Want to be an expert in one application and ran out of shows to watch on Netflix? Well, this is a 90-minute video of a walkthrough of an entire one application. So it's all the details that you may want. So I understand that's a time commitment, and it has timestamps so you can jump around to different sections. But that is, that's your 401 course on how to do the application. Setting up a one account, there's a 3-minute video link there, and then the links that Christina presented earlier, except now they're including Spanish as well. And so I strongly encourage you to take a look at those toward the bottom because those are only like what 3 or 4 pages with lots of pictures of screenshots. But there you go. That's my quickie snap overview. And one other little plug is that you'll hopefully in some of the collaboratives, it sounds like not all of them, but a lot of the collaboratives that your local collaborative will have more information about this assistance, and there's a nice Word document that describes a lot of what I just went over that you'll be covering as well.
Any questions for James before we move on from the SNAP topic? Otherwise, thanks for joining us and sharing today.
Yeah, absolutely. My pleasure. Feel free. I'll put my email in the chat too. So if you have questions, feel free to reach out.
Otherwise, we'll move on to medical. So very briefly, have a couple OHP updates we wanted to share, and then we're going to spend most of the time on OHP Bridge. So y'all should have received a message from us already. We emailed out all community partners a message about data and privacy resources. It's a 2-page document link with a bunch of document links out of it, including a member resource in English and Spanish. There are more language for that coming soon, as well as an FAQ. That is summarizing the news stories we've been hearing about immigration data Medicaid member data being shared with immigration, as well as the lawsuit that is happening about that and the state of information security at the moment. So if you're getting questions from partners or from members about this, these are the resources for you to help speak to that question and concern we're hearing. There's also a webinar that happens every couple of months. The next one's coming up in September, where we will have the Forward Together Oregon webinar on September 30th. That also had a webinar on July 22nd, where we have the slides available if you're looking for more details about the changes that are coming up via the House Resolution 1. If you're looking for information on those, I'd highly recommend going to both these ODHS and OHA web pages and registering for that webinar series. That's going to be the place to look if you're wanting information about federal changes, as we have more available about that. There's also a toolkit that the Department of Justice created. It's known as the Sanctuary Promise Toolkit. It is a collection of resources for immigrants as well. This is a lot of the questions about this will go beyond just the medical world and be general advice about immigration help and things like that. For all the legal help side of things, the Department of Justice is really the place to go to, and these are the resources to share with clients. So wanted to make sure everyone has this available. Otherwise, we're going to move along to other topics that we can more directly speak to, including one minor update that will be upcoming. We don't have the actual date of implementation quite yet, but there's going to be a one system change to the instructions on who to include on the application. So currently we have the bottom or the top 5 of these bullets here on the one system instructions. It tells you to include you, your legal spouse, your children, your partner, and anyone else you include on your federal income tax return, even if they do not live with you. The last bullet was supposed to include the situation where somebody is being claimed as a dependent, but that's not obvious to include anyone on the family who's claiming you, like anyone on that whole tax return. So to better explain that situation, we are going to add a new line about if your parent claims you as a dependent, include them and anyone on their tax return. So that will be an explicit instruction in the one system going forward. But in the meantime, please include those people as well if you are helping an application in that situation. Otherwise, we also have some improvements to the notice coming in September. This will be the start of a series of notice updates on this same kind of theme. Specifically, the ones in September, though, are going to be removing continuous eligibility language from the notices, kind of in preparation for us preparing to return renewal date language. So these won't be as part of the same update, though. In September, we'll remove the continuous eligibility line from that. Unfortunately, due to a bunch of systemic issues, in most cases, we're not actually populating that continuous eligibility online on notices. Because most of the time, when a continuous eligibility period is created, it's in a soft penned situation where the person still needs to provide information on the like to confirm their eligibility. So we don't display it in those situations, but we also aren't giving them a new notice currently once that eligibility is locked in, which means they never actually get a notification about their continuous eligibility period in most situations. We are looking, or we're fairly confident we're going to be able to reverse that part of the logic, though. So we're looking at the implementation date for being able to put that into the system, which would let us know when somebody has or let the member know when they have locked in a response to a request for information. For instance, if they applied, got an income pen for pay stubs, provided those pay stubs, it would actually send them a response when they have confirmed their eligibility there. And then the next phase of this change is going to be adding in renewal dates to those so they can tell them when they'll next need to take action. So as part of preparation for that, we are removing the continuous eligibility references where it's not needed, both removing the line and the explanatory blurb about what continuous eligibility is, as well as removing it from the names of a bunch of benefits where it was displayed in the name. So there'd be a non-continuous eligibility and continuous eligibility variation of a bunch of different things for when benefits were locked in or not. We are removing those from the naming. Those will no longer appear in names, as well as updating a particularly confusing one known as CEPACA, Continuous Eligibility Parent and Caretaker Relative Program, which bewilderingly confusingly is actually used as a placeholder for people whether or not they're actually a parent or caretaker relative. If they've invoked those continuous eligibility rules, they get that program despite not being a parent or caretaker relative. We have actually included we're both renaming that benefit and including some language that explicitly says that it is available to people even if they're not a parent or caretaker. So making a bunch of complicated minor changes essentially in preparation for larger ones returning renewal dates. We will share more about the renewal date language and a bunch of explanatory language we're adding surrounding that in future months as we get closer to that. Okay, otherwise looks like we got some questions in the chat here that I'm going to help with.
Oh, it was just me dropping links.
Oh, great. Thank you for doing that. Otherwise, moving on to OHP Bridge. So we have got a lot of questions from OHP Bridge, or from partners about OHP Bridge, as well as have a series of updates to share, as well as some reminders about updates we have previously shared in this meeting series. So for any of these things, please jump in with questions as they occur. We're going to move quickly from topic to topic here, so I want to make sure we're addressing that before we move on. So raise your hand, put it in the chat, any of those ways, but please chime in. So just general reminder, if you're not already aware, OHP Bridge is a new benefit for adults with higher incomes than OHP Plus. People who qualify for OHP Bridge must have annual income between 133 to 200% of the poverty level. They need to be between 19 to 64 years old. They need to have access to or not have access to other affordable health insurance, which includes both employer coverage or Medicare. And they need to have eligible citizenship or immigration status to qualify. A couple of these requirements have had some definitions changed recently that we'll share updates to here. Otherwise, OHP Bridge is the exact same as OHP Plus with two exceptions, which is it doesn't offer access to health-related social needs like the weather changes to your home, nutrition benefits, or housing, like rent assistance. Those benefits are not available to OHP Bridge members, and nor are the long-term services and supports, which are help with daily tasks of living, like home care workers, institutionalization in a nursing home, that sort of thing. Otherwise, it's the exact same coverage as OHP Plus. If you're interested in getting involved in this or know a member who is, we are recruiting a few different positions for the OHP Bridge Advisory Committee, which helps with financial decisions around OHP Bridge and protection of the trust fund and what benefits we should potentially add in the future and things like that. There are 3 positions we're seeking, one of which is an OHP Bridge member, as well as a healthcare provider and a health equity specialist. So either your clients or maybe yourself can qualify for it. well, I guess for partner might qualify for any of the two latter of those. But if you're interested in applying to be a member or know someone who is, we have our OPAC member information sheet available on our OHP Bridge Advisory Committee website. Applications are open through the end of the month, so if you're able to get that in this month, then we'd love to have people get involved in that. Otherwise, you may have seen some news lately about changes to the immigration status rules for both the Marketplace and OHP Bridge. So OHP Bridge inherits its immigration status rules from the Marketplace and uses the same standards there. Back in November of last year, there was a change that was announced that made people or more immigration statuses, including deferred action for childhood arrivals, DACA status, eligible for OHP Bridge and Marketplace. For DACA folks specifically, though, that was just reversed, and people with DACA status are no longer going to be approved for OHP Bridge. For Marketplace, they are able to keep their coverage until the end of September if they're a current member. But for OHP Bridge, we do not yet know when this is going to affect the current members. There's about 75 of them, and we do not have an answer from the federal government yet on when they'll be affected. Just a second to take a break to sneeze, and I'll be right back. Excuse me, sorry for that. Okay. So there's about 75 members who have OHP Bridge currently in DACA status. We do not have an answer yet on them. We will share more information as it becomes available about when their coverage would be affected. For the moment, though, we already put it in the one system build because OHP Bridge start dates would mean that anyone getting approved now would be after the date of the effective rule, effective date of the rule. So we had to stop new enrollments now. And as a result of that, the question in the one system about DACA status has already been removed. Going forward, if you're helping someone with DACA status apply, you would enter them as not having one of the listed immigration statuses on screen. Just check no on that box, and that would be the correct way to mark someone with DACA status. Any questions about that? Otherwise, we'll keep on moving. We also had some questions recently about newborns in OHP Bridge, specifically calling out that it wasn't mentioned that OHP Bridge, the children born to OHP Bridge members do not get the same assumed eligible newborn protections. Assumed eligible newborn is a term that we use to refer to a protected status for a child born to somebody on Medicaid, where they automatically get, like the child can use the mother's Medicaid and gets approved based on that. OHP Bridge Basic Health Program, though, is technically not a Medicaid program. It's that Basic Health Program term. So it does not carry those same rules, and they do not automatically get approved based on the mother having OHP Bridge. So someone who's born to a mother on OHP Bridge would need to complete a application, like do the one system process or to add them to the case in order to begin benefits, and should request any retroactive coverage that's needed. They're not going to automatically get extended backwards. So if you're working in a hospital or in a clinic that sees a lot of newborns, this can be a relevant distinction. We want to make sure you know to do an application in that situation and not assume it's going to automatically get extended based on the being born to someone on OHP Bridge. So difference there between OHP Bridge and other programs. We also got some feedback in the last month that we're wondering how to enter application or a offer of coverage that was not accepted. So in addition to telling us about coverage that somebody's enrolled in through an employer or something, we also need to hear about if they're offered coverage through an employer, kind of the same way the Marketplace application would ask about that. Previously, we had all of the access to other health coverage information combined into one screen. When OHP Bridge launched, we also created a second screen, which asks the access to health coverage screen here. Unfortunately, when we implemented that, we did not update the instructions on screen on the first page, the healthcare coverage and benefits information screen. There was a line here that says health insurance coverage and offer for it or are eligible for it. Going forward, that line's actually going to be removed. We got some good feedback there that is confusing, and that actually the instruction should be to not enter an offer of coverage that was not enrolled in on this screen. So this should only be used for coverage that you're actually enrolled in. On the second screen in the series, the access to health coverage one, this specifically asks only about offers of coverage that you're not enrolled in. So enter that information here if it's an offer of coverage you haven't accepted. If you're actually enrolled in it, you would enter it on the healthcare coverage and benefits information screen, the first one in the series. We will be updating those instructions in the one system itself. I'm not quite sure when that'll be happening, but it should be in the next couple months, it sounds like. Appreciate the feedback when you see things confusing in the system. That way we can correct things like that. Another question that we got a few times was about not being able to see the client ID numbers for a member when they've been approved for OHP Bridge, but before the benefits have already started. A lot of assisters are used to writing down the client ID number at the end of their appointment to be able to give that to a client. But since OHP Bridge has those future start dates, the system was not displaying those and making that not possible for clients. We did get that updated. That update just rolled out late last week on the 8th, and that should now be visible in the system like immediately after approval. Once the one system makes the decision, if they've been approved, it's going to display their client ID number as well as the effective date. Now that we have an expanded effective date range displayed there, that should hopefully be clear to members and not cause any confusion there. So we got that added in, and hopefully that'll support the need. Please let us know if there's any challenges there. Otherwise, over the last few months, we've shared a range of different issues OHP Bridge has been going through at the collaboratives. Wanted to provide some updates about those, as well as just a recap and reminder and opportunity to ask any questions about those. First of which was the OHP Bridge TPL cleanup effort, which TPL is our term for other health coverage. We call it third-party liability. There's an ongoing effort to clean up mismatches that can occur when somebody has old information in MMIS, the Medicaid Management Information System, which is our system that controls CCO assignment, billing, and things like that. Information that appears there can cause billing problems, but it also, in some cases, doesn't get transferred over to the one system, which is going to need that information for eligibility purposes as well. For OHP Bridge members, if there's old information in MMIS, but that information doesn't appear in the one system, we need to figure out whether or not that's actually active old coverage or if it's just outdated information that we should be removing. We've got about 1,500 people in that situation where they've got coverage in MMIS, but not in the one system, where we need to figure out if they're eligible to keep OHP Bridge, essentially. So process there is going to be first our workers doing an outreach call to members to try to verify that with them verbally. They're then unable to reach them after a couple attempts. They're going to proceed to sending a written request for information. Going to follow the standard template for those. And if the member didn't respond to that whole process, they could have their benefits closed for lack of response. But the main goal for this is probably just going to be removing outdated policies from MMIS. Since on their most recent application, the member didn't say they had other health coverage, that probably means a lot of these are just out of date, but we need to confirm that with them. If there are policies that are still active, though, we want to get that added into the one system. That way we can run that affordable coverage test for any employer plans. If they are enrolled in an affordable employer plan, though, we would end benefits as a result of that. So for partners, this hopefully should be a pretty simple request. You're not going to see a major wave of these. These are going to be happening slowly over many months, and then just ongoing cleanup work will continue. So won't be a big wave of them, but you may see some occasional requests for information that clients are receiving, or they may mention that they got one of those calls. And then pay particular attention to entering TPL info when applying, including those offers of coverage, talking about those screens that we just shared. And remind members to update those when they have changes now that the one system is actively running those affordability tests for the members. We need to know that information about their offers of coverage that are available to them or that they're enrolled in. Otherwise, quick graphic about this change in the process. Starting from the upper left, once we have identified a case where the OHP Bridge member has health coverage in MMIS, we're going to reach out to them. If they don't respond to us at all, we would follow the left path here and close benefits for non-response to request. Otherwise, if the coverage is still active, we're going to follow the right path. Otherwise, if they do respond to us, we're going to follow the right path where we ask if coverage is still active. If it's not active, great, we can let them keep OHP Bridge and we'll have the information in the system cleaned up. We'll just remove it from MMIS in that situation. Otherwise, if it is active coverage, we need to ask if it's an employer plan and if it meets the affordability standards. If the answer is no to one of those two, so it's not an employer plan, it's like bought directly through the company outside of the marketplace system, something like that, or if it's a employer plan that does not meet the affordability standard, then they can keep their OHP bridge with the correct information on file. Otherwise, if they are enrolled in an affordable employer plan, in that case, they never should have got OHP bridge. They just didn't provide us the information about that, in which case we're going to end benefits as a result. Any questions about this cleanup effort that's going to be happening? Otherwise, we'll move along to our next issue there. Just check the chat real quick. Looks like we got a question from Grace. Under a loss of health coverage, if you lost health, Medicaid or CHIP in the last 90 days, you may qualify for a special enrollment period. I wonder if the 90 days info listed above is still good. In general, it should be a 60-day special enrollment period. To my awareness, you can check out this link real quick. Looks like I'm seeing 60 days mentioned here. My awareness is that it should be a coverage loss within the last 60 days. So
Yeah, you keep scrolling down a little bit. Keep going down. Yeah, just there. Stop there. Yep.
I would have to ask the marketplace team about the distinction between these two rules. I'm not sure when the 90-day situation would occur based on that. I'll have to take them on back and get the answer. Let me pull my slides back up. I think we had another question as well. How quickly will benefits end? So when we end benefits, it follows a schedule similar to the graph on screen, where if we end benefits in the first half of a month, it'll be at the end of the current calendar month. So if we ended benefits today, August 12th, like we take the system action to end, they would end on August 30th. If they instead get that change process in the second half of the month, so August 16th, that would kick it out to the following month, and they would end on September 30th. So it's the first half of the month, same month. Second half of the month, end of the following month. Hopefully that addresses it. Okay, and then before we dive into the next issue, we wanted to provide a reminder about how start dates work for OHP Bridge, which follow a similar first half of the month versus second half of the month thing, where if we approve someone's application in the first half of the month, their benefits would start the first of the next month. So in August 12th, today, determination would result in a September 1st start date, compared to a August 16th determination would result in an October 1st start date instead. We skip a month in that situation. That will interact with a few different rules here and be relevant, but that is all based on the date that we actually approved the application, not the date that the member applied. So there's an additional 45 days of potential processing time that can stack up with that as well. Though updating or expediting the application through any of our urgent routes can make that 45-day application process go much quicker. So we wanted to share some updates about the issue we previously discussed in April, which is the open enrollment coverage gap issue. Specifically, when someone updates their marketplace application during open enrollment season and it thinks that they're eligible for OHP Bridge, it's not going to let them re-enroll into a plan for the next calendar year, which can stack up with those wait times and the start date rules to produce a 1 to 3 month gap in coverage while they're waiting for their OHP Bridge to start. If a member is affected by that, where they moved from the marketplace and then ended up with OHP Bridge in February, March, or April this year as their start date, they're going to be able to request an adjustment to the start date to move it back to the beginning of the year, closing the gap in coverage. That would let them bill any services that they received from healthcare providers into OHP and get those paid for and off their name. So about 1,500 members appear to be in that situation where they got sent by the marketplace and ended up with a corresponding start date. We're going to mail them a notice in September about the option to request a start date adjustment, and then we'll be following up with them as well to help them rebuild the services. So they'll call eligibility in order to get those start dates moved. And then once that's happened, either they can call the providers on their own, or we'll have our client services unit reach out to the member to help them rebuild those services and get those paid off their name, essentially. Though not all services will be able to be rebilled if someone received services from a provider that's entirely out of network with OHP, or if they pharmacy services will often be too old to be rebuilt as well. So not all services will be able to be qualified for them, but most medical services or dental services would. So should be helpful for members who have bills during that time. We got a little graphic here of how that works, starting in the bottom left. Someone updates their marketplace application in the first part of December. That would start their 45-day review period, which runs until the second half of January. Though the marketplace would end up closing their coverage at the end of December and not letting them re-enroll into the new plan year because it thinks they're eligible for OHP Bridge. We may not decide that whether or not they're eligible until the second half of January, though. And if it's in the second half of January, we would assign a March 1st start date, leaving a 2-month gap in the purple dotted area where someone's not eligible for OHP Bridge at that time. Though they could move the start date forward back to January 1st, which would let us cover any services during that gap. So that'll be what's happening for those folks. Unless we have any questions about this, going to move on along in the interest of time and talk about our annual income lower limits. This is the change we announced back a couple months ago now, where previously the one system was approving anyone below 200% of the poverty level annually for OHP Bridge, including people with annual income between 100 to 133% of the poverty level, which was a design error. Those people should be referred to the marketplace instead. So after the update, one is only going to be approving members who have monthly income above the 138% limit for OHP and annual income between 133 annually. So you need to be above OHP limit and in the OHP Bridge range. If you're instead below the OHP Bridge range and still above that OHP monthly limit, you'd be referred to the marketplace instead. Though note that OHP's monthly limit is higher than that 133% annual number. So in order to be affected by this, it really needs to be a variable income situation where somebody's had a job for part of the year or has variable income or something like that. Otherwise, if you're consistently in that 133%, 100 to 133% range on an annual basis, there should be months where you would qualify for OHP Plus based on your monthly. So this is a gap that tends to happen for specific periods of time, and they'll qualify for one program or the other in the future. We did get the community partner income guides updated for that as well. If you haven't checked that recently, it now has the lower boundaries for OHP Bridge in there at the same link. Otherwise, we updated the system in 2 steps. Back in June, we stopped new enrollments, and then on July 15th last month, we checked to see if the current members continued to qualify. The outcome on that was that about 1,000 members had their benefits ended and referred to the marketplace, with benefits ending July 31st. About 100 members are still in the process of deciding. They didn't get through the mass update process and are going to need to either work a review or a request for information in order to make that decision. And then we had about 525 that retained benefits, about 500 keeping no OHP Bridge due to income differences between last year when they applied and this year, making them eligible for OHP Bridge again. And then about 25 moved to OHP Plus instead based on monthly income. So less covered people lost coverage than we expected. So that's some good news there. So we've got a bunch of steps we took to help them retain benefits if possible as well, which included one system outreach to members in their preferred language. We had the eligibility notices sent out in mid-July, customized with language for the situation, as well as had the one system send text messages on July 29th, in addition to the automated notices where members select their contact preferences. So we did a little extra for them as well. We also communicated out a list of affected members to assisters, so you should have heard it from us if you had an affected member. We talked about it at this office hours and local collaboratives as well. Marketplace also did some outreach to members from their side, including social media posts generally aimed, text messages, and emails, and direct mail to members, and a bunch of partner engagement on their side to Marketplace partners. Otherwise, there's a quick chart here that might be helpful explaining how the annual income limits work now. So we're only going to consider annual income once somebody has already been found over the monthly income limit for OHP plus. Once we're looking at annual income, though, if they're below the poverty level itself, they would qualify for OHP on that basis. If they're in that 100 to 133% range, they would qualify for Marketplace. If they're in that 133 to 200% range, that's going to be the OHP bridge range going forward, with anyone over 200% still qualifying for Marketplace, unchanged from before. There are chart versions of that if that's helpful for you, which will be in the slide deck. Otherwise, we also have a couple examples we've been sharing with folks to help lock this in. Specifically looking at what does somebody qualify for, or what does Grover in this instance qualify for? As a single adult who is unemployed for part of the year and starts a job earning $2,000 a month before applying, that leaves, if he was unemployed for 3 months, annual income for the year of $18,000 in 2025. If you can put a response in the chat, just to kind of confirm understanding and whatnot, what did Grover qualify for in 2025? We're first going to look at that monthly income, compare it to the single adult limit, see whether he qualifies for programs based on monthly income. If not, proceed to look at annual. That should put him into the Marketplace range for 2025. However, for 2026, if he continues that job, that would put his income up to $24,000 for 2026. That would probably put him into the OHP Bridge Basic Health Program range for 2026, which means reapplying in December would be good advice to give to this client. That way he could get back onto OHP Bridge at that point and get free coverage. Okay, we're getting to the end of our time, but we're going to power through the. We've got a bunch of questions we've remembered for the last month that we just wanted to provide responses to as well. If you want to submit questions, there's an OHP Bridge email you can do so, as well as through the registration form or through your regional outreach coordinator to do so. So we got a question about somebody applying for OHP Bridge, but hearing that it takes up to 45 days to get approved while being out of the country, wanting to know if that would cause them problems responding to mail. Answer to that is that we can take up to 45 days to process the application, but it doesn't take that long. We may need additional information to make that decision though. So contacting or having access to your online one account in order to be able to check your messages and respond online would be an easy way to do so from another country. Otherwise, calling in or getting help from a community partner to make the process go more quickly could short circuit that 45-day response time and get the decision made faster. That would be separate from the start date rules though. So just getting the application process completed and the request for information responded to will be the things that she'd want to take before getting out of the country, or while out of the country if she's able to maintain access through the online account. We also got a question about what happens when somebody's income increases and pushes them outside the coverage limits for OHP. Will OHP Bridge automatically kick in, or is this something that they need to apply for? If so, how would they apply, and what time period is the income eligibility based on? So in most cases, OHP members have protections called continuous eligibility, which means their income increases wouldn't be considered until their next renewal, essentially. They'd keep benefits until their next renewal. Then when we go through the renewal process, they'll be screened for OHP Bridge as part of that process. It's all through the same system, so there's no need to fill out a separate application, just complete the renewal process instructions. Eligibility for OHP is going to be based on the current monthly income, and that's going to be what those programs are decided on. OHP Bridge, on the other hand, is going to base eligibility on the current annual income. Hopefully that addresses that question. It looks like we got one in the chat as well. Got a
Read it
question
out.
from Susan.
Yeah, do you want
If
me to read it out?
that'd be great.
So it says if a family has CE until 2026 and misses the active renewal date, but then responds to it before they end benefits, will they keep their CE and continue until the end of the CE period, even if they are now over income? How about if they respond within the 90-day reconsideration period, will CE be honored?
I'm going to have to take the 90-day reconsideration one back to a policy person for an answer. If they respond before they end benefits, they should be able to continue until the end of their CE period, though the protections would continue to apply until the end of that period. So telling us about the income change before benefits end shouldn't make them end earlier. How that works if they're after the response period in that reconsideration period, I'll have to double check that one though. So we will get you an answer on that part.
Thank you.
Otherwise, we also got a question about, can an offer of health coverage that is inaccessible due to safety or distance make you ineligible for OHP Bridge? So there's a difference there between the two types of inaccessible coverage. If an offer of health coverage is inaccessible due to distance, that likely makes the person ineligible for OHP Bridge. On the other hand, if coverage is inaccessible due to safety concerns, there's a question in the one system about this, and that applicant may be eligible for OHP Bridge in that situation. So safety concerns, we're not going to consider that offer of coverage that's accessible to you, and you can still be eligible for Bridge. We got a question about the start date adjustments we shared earlier. If someone is not enrolled in a marketplace plan in 2024, but applied through healthcare.gov last open enrollment, then was referred to OHP Bridge, and has medical bills in the month before OHP Bridge started, could they request a start date adjustment? So the difference here is that they're not enrolled in a marketplace plan in 2024, which unfortunately means that they're not going to be eligible to get that start date moved. We're only offering that in a specific set of the start date adjustments in a very specific set of circumstances. We do not have generally available retroactive coverage for OHP Bridge members. If you are running into someone who's likely to be in this situation, though, especially next year in open enrollment and whatnot, if they're waiting on an OHP Bridge determination, and have any medical need attached, I would highly recommend contacting CP Assistance in order to get urgent processing applied to that application. That way they can reduce the 45-day processing time step out of that and hopefully sync up the start dates better. We also got a question about eligibility. My patient has been on Medicare due to disability, but is no longer deemed disabled, and her Medicare is ending soon. I calculated her and her husband's monthly income as $3,000 a month gross. Would this fit the OHP Bridge income guidelines? The answer here is we don't really know. Unlike other OHP programs, which primarily use the monthly income, OHP Bridge Basic Health Program is going to be based on annual income for the current calendar year. We would need more information than the question provides here as a result, because we cannot just annualize a monthly income. As a result of all those changes and distinctions between monthly versus annual incomes, it might take some adjustment to get used to not converting those back and forth as if they're equivalent amounts. We need to actually base the determination on the current monthly income that the client attests to and their best estimate of their annual income for that year, rather than converting them back and forth. Especially with Social Security disability benefits ending, as this situation kind of implies, that suggests that their income earlier this year is likely not the same as their annual income for the whole year without that monthly income source. So we need to consider both those quantities and ask that specifically. A very similar question here is, I'm looking for some clarification about the income limits. They were told that the OHP income limit is $1,800 for a single filer, and the OHP Bridge range is $20,820 to $31,000 annually, but 1,800 is $21,600 annually, so they found this confusing. all of the numbers in this question are correct, essentially. These are the limits. But we need to be looking at those separately, which is why they're quoting them separately. We can't just convert those back and forth into monthly versus annual because there are situations where income changes and those aren't going to line up perfectly. And we have to go off of the actual annual projection and monthly projection and not just convert it back and forth. So that also, there's also the difference in the actual income standard that's being compared to, where OHP Plus's monthly income limit is 138% FPL, whereas the OHP Bridge minimum boundary is 133. So the OHP Plus monthly limit is higher than the lower income boundary there. That means that multiplying 1800 by 12 is going to give you someone who's about 138% annually. They fall into the range to qualify for OHP Bridge in that situation, but we can't annualize those incomes. Looking at the actual projection from the client is going to be what we need to do on those, and that's going to be a bit of a adjustment for kind of how we think about eligibility and not being able to just move those back and forth and convert back and forth to figure out what someone's eligible for. We're going to have to run that two-step process each time.
And Sean, I just wanted to point out that we are a
Yeah.
couple of minutes over time.
I think we've got like 2 more left,
Okay.
so almost done.
Okay.
Other question was, what if someone's projected annual income ends up being wrong and they make more or less? In that case, members just need to provide true and complete information to the best of their ability. And then when they know that they're making more or less, they should report those changes to us. If income changes that makes the bridge member qualify for OHP Plus, they would move based on that and upgrade benefits. Otherwise, if their income moved outside of the OHP Bridge range, they would keep their OHP Bridge benefits for the remainder of the 12-month coverage period. So that was the last for questions. Happy to take any last minute ones from anyone in the group. Otherwise, we are over our time. Thanks for staying with us. Happy to hold space for any questions. Otherwise, we will see y'all again next month with even more updates to share.
Thank you, everyone. And I'll go ahead and stop the recording now, but we'll happy to stick around for a few more minutes if anybody has questions.